Hello everyone, welcome back to the class of biotechnology. Today we are going to discuss about the axial skeleton. But before moving forward, if you are new here, please like and subscribe to this channel so that you cannot miss any of the future video. So let's start with the axial skeleton. The axial skeleton is the mainly consists of 80 bones, and it includes the skull, middle layer bones, hyoid bone, vertebra sternum and ribs. The skull consists of two major regions, that is the cranium and the faces. The skull is the most complex region of the skeletal system and not only the house of the brain but also it contains a significant number of the sense organs. The cranium consists mostly of the flat bones, while the face consists of several irregular bones. There are six bones that constitute the cranium bones, that is the parietal bone, sphenoid bone, occipital bone, temporal bone, frontal bone, and ethmoid bone. So some of these bones exist single while other are exist in a pair, like the frontal bone, occipital bone, sphenoid bone, ethmoid bones. These are the bones that exist single, and the parietal bone and the temporal bone of the cranium exist in a pair. So the frontal bones forms the forehead, the occipital bones forms the back and the base of the skull, the sphenoid bone located at the base of the skull, the ethmoid bone located between the nasal cavity and the orbits. But if you talk about the parietal bone, so it forms the sides and the roof of the cranial cavity, the temporal bones located at the side and the base of the skull. So these were the six bones that comprises the cranium. Apart from these six bones, there are some minor bones also, or the part or the features of these sub features of these bones. That is the lambdoid structure, and then the squamous structure, zygomatic process, squamous structures, external acoustic meatus, mastoid process, styloid process, mandibular condyle, then the coronal suture, temporal lines, nasal bone, lacrimal bone, zygomatic uh, cofacial foramen or foramen, then infraorbital foramen or foramen, zygomatic bone, maxilla, temporal process, mandible, and mental foramen. So these are the different features of the cranium bones. Parietal bone, temporal bone, maxilla, zygomatic bones, nasal bone, lacrimal bones, and mandible are the some bones that exist in pairs. We have already discussed about the parietal and the temporal. Now the maxilla. Maxilla is form the upper jaw. Zygomatic bones forms the cheekbones. The nasal bones form the bridge of nose. The lacrimal bones is the part of eye socket. Mandible bone, though it is a single bone in adult, it's considered paired as it has a two halves that join at the chin. So these were the few bones that exist in pairs. To remember the bones of the cranium with the mnemonic of pets. Of pets means of pets. So each letter here represents a cranial bone. O means occipital, F means frontal, P means parietal, E means ethmoid, T means temporal, and means sphenoid bones. So in this, using this uh, mnemonics, you can learn the names of the cranium bone. If we see the anterior view of the skull, then the features of the bones, or you can say the bones of the faces, are featured or listed as the frontal bone, glabella, supraorbital foramen, supraorbital margin, sphenoid bone, palatine, nasal bone, inferior nasal concha, zygomatic bone, mandible, mental foramen, mental protuberance, the parietal bone, temporal bone, orbit, lacrimal, nasal septum, ethmoid bone, vomer, maxilla, intermaxillary suture, and infraorbital foramen. So these are the different features of the bones of faces. Major bones that comprises the bones of the face are the maxilla, mandible, vomer, lacrimal, nasal, palatine, and zygomatic and inferior nasal concha. To remember the names of these bones, you can use the mnemonics. Monkey in New Zealand like peaches very much. Monkey in New Zealand likes peaches very much. So you can use the first letter of each word, that is M. M for maxilla, I for inferior nasal concha, N for nasal bone, Z for zygomatic bone, L for lacrimal, P for palatine, V for vomer, and M for maxilla or mandible. If we discuss the features of the cranium bones, then the frontal bone is located at a forehead region, and it forms the anterior cranial fossa and contains the frontal sinuses. The occipital bone is located back and base of the skull, and it contains the foramen magnum through which the spinal cord connects to the brain and forms the posterior cranial fossa. The sphenoid bone is located central part of the skull, and it resembles to a butterfly. The features of the sphenoid bone is that it houses the sphenoid sinus and contains the sella turcica, which holds the pituitary gland. Next, the parietal bone. It is located side and roof of the skull, and it forms the lateral walls and the roof of the cranial cavity and articulate with frontal, occipital, and the temporal bone. The temporal bone is located lower side of the skull and enclose the structure of the ear and feature of the mastoid process for muscle attachment. The ethmoid bone located between the nasal cavity and the orbit, and it forms a part of the nasal septum and the lateral wall of the nasal cavity and contains the ethmoid sinuses. The major features of the bones of the faces, uh, that is for the palatine bone, it is located at the back of the oral cavity and forms the posterior part of hard palate, and the vertical palate or the plate contribute to the lateral wall of the nasal cavity. The maxilla bone of the face located at the upper jaw, forming the central part of the faces, and it contains the maxillary sinus and features the alveolar process housing upper teeth, articulate with the numerous bones, including the frontal, nasal, and the zygomatic bones. The third one is the mandible, and it is located at the lower jaw. And the features here include the body, rami, and the mental foramen. The body, that's the horizontal part that contains the lower teeth. The rami, the two vertical extension on either side. The mental foramen allow nerves and blood vessels to pass to the chin and lower lip. Then the fourth bone is the vomer. It is located or it forms the part of the nasal septum, and it articulate with the sphenoid, ethmoid, maxilla, and palatine bone and helps separate the left and right nasal cavities. The fifth bone is the lacrimal bone, and it is in the middle wall of the orbits, and it is the smallest bone of the face. and articulate with the frontal, maxilla, and ethmoid bone. The sixth bone is the nasal bone, and it is the bridge of the nose. The two small rectangular bones forming the top part of the nasal cavity and support the structure of the nose. The seventh bone is the zygomatic bone, and it is the cheekbone, or it is located at the cheekbone and forms the prominence of the cheeks and articulate with the maxilla, frontal, temporal, and the sphenoid bone. The eighth bone is the inferior nasal concha, and it is located inside the nasal cavity. It is curved, thin bones that projects from the lateral wall and the nasal cavity and increased surface area for warming and humidifying air. So these were the few features of the bone of faces. Next, the skull also contains a several major foramina, that is the opening that allows the passage of the nerves, blood vessels, and other structures. Here the key foramina and their locations. The cranial foramina include the foramen magnum, optic canal, superior orbital fissures, foramen rotundum, foramen ovale, foramen spinosum, jugular foramen, and hypoglossal canal. So the foramen magnum is located base of the skull in the occipital bone. Here in the occipital bone, and the function is that it allow the passage of the spinal cord. Next is the optic canal. Optic canal is located at the sphenoid bone here, as you can see this area, optic canal, and it transmit the optic nerve and ophthalmic artery. The next is the superior orbital fissure. It is located between the greater and the lesser wings of the sphenoid bone, and the function is to transmit the cranial nerve. Next is the foramen rotundum, and it is also located at the sphenoid bone, and it transmits the maxillary nerve. Fifth one is the foramen ovale, and it is also located at the sphenoid bone, and the function is to transmit the mandibular nerve. The sixth one is the foramen spinosum. The foramen spinosum is located also on the sphenoid bone, and it transmits the middle meningeal artery. The seventh one is the jugular foramen. The jugular foramen is located again between the temporal and the occipital bone, and it transmits the internal jugular vein. The eighth one is the hypoglossal canal, and it is located at the occipital bone and near the foramen magnum. It transmits the hypoglossal nerve. So these were the few foramen or the opening that allow the passage of the nerves, blood, or the blood vessels or other structures. The next feature of the axial skeleton is the fontanelles. The fontanelles are the soft spot of an infant skull. There are total four types of fontanelles, and some of them allow for the passage of the skull through the birth canal by enabling the bones of the cranium to slide over one another. After birth, the fontanelles allow for further expansion of the skull. So total there are four types of fontanelles. So we are going to discuss each of them one by one. So the first one is the anterior fontanelles, and it is located at the junction of the frontal and the parietal bone, and it's shaped like a diamond, and it is typically closes by the age of 18 to 24 months. Next is the posterior fontanelles, and it is located at the junction of the parietal and the occipital bone. It is triangular in shape, and it usually aged, or it usually is seen up to the month of 2 to 3 years. Oh, sorry, 2 to 3 months. And the third one is the sphenoid fontanelles, and it is also called the anterolateral fontanelles, and it is located at the junction of the frontal, parietal, temporal, and sphenoid bone. It is irregular in shape and generally can be seen up to the month of 6 only. The fourth is the mastoid fontanus, and it is also called as the posterolateral fontanus, and it is located at the junction of the parietal, occipital, and the temporal bone. Its shapes irregular, and it can be seen up to the month of 6 to 18. So this was all about the fontanels. Here in the image, you can see the fetal skull and the fontanels in the diagram. The next feature of the axial skeleton is the vertebral column. The vertebral column in the human, is significantly different from the other mammals in that we are the only habitually bipedal mammals, and in humans the vertebra increase in size from the cervical to the lumbar vertebra, and this is due to the increase in weight on the lower vertebra. There are 5 regions of the vertebral column, that is the cervical vertebra, thoracic vertebra, lumbar vertebra, sacrum, and coccyx or coix. The spine of the vertebra column has a 4 curvature. These allow for the balance in an upright posture, that is the cervical lordosis, thoracic kyphosis, lumbar lordosis, and the sacral kyphosis. The cervical lordosis is a convex and bowed forward when seen in anatomical position. The thoracic kyphosis looks is a like a concave mirror, and the lumbar lordosis looks like a convex, and the sacral kyphosis looks like a concave when seen in an anatomical position. The, the in addition to these, there are some abnormal spinal curvatures. That is the scoliosis is a lateral curvature, as you can see here in the image, and the hyperkyphosis is an exaggerated thoracic cervical, and the hyperlordosis is an exaggerated and lumbar curvature commonly seen during the pregnancy. So these are the some abnormal spinal curvatures. Let us discuss in a brief about each vertebral column one by one. Start with the cervical vertebra. So these or there are about 7 cervical vertebra and are listed as C1 to C7. These are distinguished from all other vertebra, as in each has a 2 transverse foramen. Next is the thoracic vertebra, and these there are around 12 thoracic vertebra and are listed as a T1 to T12, T1 being the most superior one, and these are having an attachment point for the ribs. You can see the different features of these cervical and the thoracic vertebra in the image here. Next is the lumbar vertebra. There are 5 lumbar vertebra, and they are not having the transverse foramen and the rib facets. So in that respect, the lumbar vertebra is different from the thoracic or the cervical vertebra. The spinous process is more horizontal than the thoracic vertebra. In case of the lumbar vertebra, the body of the lumbar is large and carry more weight in comparison to the thoracic vertebra. The figure 8.16 represent the articulated vertebra in a lateral view. The next feature that contributes to the vertebral column is the atlas and the axis. These are the part of or located at the um, cervical vertebra, and it is the first cervical vertebra and is known as the atlas, and is only cerebral vertebra without the body. The atlas carries the weight of the head, and the atlas joins with the head and allow you to nod your head to indicate yes. The second cervical, that is the C2, is the axis, and it has a unique process called the dens, or you can also call it as a odontoid process that runs superiorly through atlas. The dens allow you to rotate your head to say no. So these were the few attributes of the cervical vertebra. The last 2 attribute of the vertebral column is the sacrum and the coccyx. The sacrum is the large wedge shaped and it looks like a shallow triangle bowl and is composed of the fused vertebra. And the lines of the fusion is called the transverse lines. And here the sacrum allow the acrum, upper part of the body to carry more weight. If we talk about the coccyx in the coccyx is the terminal portion of the vertebral column and it consists of the four fused vertebra. Coccyx is fused with the sacrum in some individuals. Example in a female who disarticulated the joint during the childbirth. The image here represents the sacrum and coccyx in an view and the posterior view of the image. You can see here, and the other features of these are listed here. The other feature of the axial skeleton is the thoracic cage, and it consists of 12 pairs of ribs and the sternum that protects the lungs, the heart, and yet providing the flexibility during breathing. M- Median suprasternal notch, clavicular notch, manubrium, sternal angle, body, costal notch, and xiphoid process are the main bony features of the sternum. There are 12 pairs of the ribs along with sternum and thoracic vertebra that makes up the thoracic cage, and each rib has a head that articulate with the body of one or two vertebra. The narrow region near the head is a neck of rib, and the process near the neck on a rib, that is 1 to 10, is the tubercle of the ribs. The tubercle articulate with the transverse process of vertebra. In the image, you can see the different features of the individual ribs and the articulated ribs. So this was all about the articulated ribs and the individual ribs. Apart from this, one more feature that comprises the axial skeleton, that is the hyoid. And the hyoid is a floating bone found at the junction of the floor of the mouth and the neck. The hyoid may be anchored by muscles from the anterior and the posterior or the inferior direction. It aids tongue movement and swallowing. The larynx and the trachea are suspended from the hyoid by the thyroid ligament. So this was all about the axial skeleton. So thank you so much.